The ram lesion has been introduced over 20 years. It used to be under-recognized, but raised more attention in recent years. You can see the publication of the recent years. The incidence of ram lesion was reported from 10 and up to 40%, and the risk factor include chronicity of ACL, gender, age, and sports activity involvement, and very interesting, the posterior tibial slope. And two injury mechanisms can be applied to ram lesion, but non-specific. One is overload theory, which can explain the chronic ACL and ram lesion. And number two is so-called contraction of the semimembranous muscle theory, which can explain the acute ACL and acute ram lesion. So how important? There's a study showed that without repairing the ram lesion, both of the anterior laxity and the axial rotation laxity could not be restored to the normal value. So the diagnosis, of course, the golden standard should be arthroscopy. We strongly recommend establishment of the posterior medial border to confirm the ram lesion. And for the diagnosis of MRI, the conclusion is quite variable from author to author. Regarding the treatment, the Professor An from Korea, he developed a very beautiful all-inside suture technique. It's well known, and he pointed out that the ram lesion should be repaired because it's unstable with the rigid motion of the knee joint. And on the other hand, we found that there are some clinical cases of ACL and ram lesion. Even though we leave it alone, it can heal spontaneously. So we conducted a randomized control study. The conclusion is that there's no significant difference between the repair group and non-repair group in a cohort of ram lesion, short in length and stable ram lesion. So conclusion is the ram lesion is uniquely associated with ACL injury, and the prevalence is higher than anticipated, and the diagnosis should be, the golden standard diagnosis should be arthroscopy, and regarding the treatment, the surgical repair is only indicated for the long and unstable ram lesion. Thank you very much.